Hi, welcome to OneMD Nutrition Studios. My name is Jennifer Fontaine. I am the creative brand manager. I help steer the course of this brand, and I work with some really fascinating and intelligent scientists, doctors, marketing gurus, and I'm really happy to have here with us today Dr. Adam Kreitenberg. He is a OneMD physician formulator, and I've been working with him for the past couple of years now. We're going to bring him in now and to talk a little bit about arthritis, I wouldn't say celebrate, but National Arthritis Month. But before that, we're going to just do a quick little disclaimer. This live broadcast presentation only reflects the views of OneMD's board-certified physicians licensed in the state of California. The statements made in this YouTube live broadcast presentation have not been evaluated by the FDA, are not intended to diagnose, treat, cure, or prevent any disease, and are intended for educational purposes only. The information contained in this broadcast should not be used in any legal capacity whatsoever, including but not limited to establishing standard of care in a legal sense or as a basis for expert witness testimony. Please consult your physician before beginning any new supplement, medicine, treatment, or therapy. Under no circumstances shall the OneMD YouTube live broadcast presentation's guests, contributors, or any employees, associates, or affiliates of OneMD be responsible for damages arising from the use of the OneMD YouTube live broadcast presentation. This OneMD YouTube live broadcast presentation and all information provided within is protected by the U.S. and international copyright law. Reproduction and distribution of this material without written permission of OneMD is prohibited. All right, thanks for the legal stuff. Thanks for sticking with us. And now it's my pleasure to bring on Dr. K, as we like to call him in the
How
office.
Are you, Jen?
I'm great.
Yeah.
How are you doing?
I'm wonderful. I really thank you for and cherish this opportunity to bring me with OneMD Nutrition to talk about National Arthritis Awareness Month. This is a perfect time, as good as any, early in the year, to educate patients and make them more aware of the things that surround arthritis in general. So we're talking about causes of arthritis, how to treat arthritis, what people can do to improve their current symptoms, but maybe even better, prevent the onset of arthritis symptoms in the future.
Absolutely. Well said. I'd like to start a little bit, talking to you about yourself, your profession and your trajectory, how you came to be a rheumatologist, and a little bit about your relationship with OneMD Nutrition.
That's a great question. So first off, I started working with OneMD Nutrition about, I want to say 2 or 3 years ago. So you're right on that right about that, Jen. But I became a board-certified internist and rheumatologist. Dating back, I don't know, I want to say it's almost 10 years now. And one of the reasons for wanting to go into medicine and rheumatology in particular was seeing how much my mom suffered from her arthritic conditions. So she unfortunately suffers from psoriatic arthritis, which is not only the kind of degenerative arthritis that most people suffer from, but it's an autoimmune inflammatory type of arthritis. And I saw as a young child the kind of discomfort that she experienced during that time. And that was kind of one of the things that drew me closer to rheumatology, drew me closer to taking care of joint diseases. And that's kind of what led me to go sort of into that profession, but more so is part of treating patients is not just treating the individual patient, treating the individual knee, treating the individual joint. It's treating that patient in a holistic approach. And when we do that, there's a lot of different sort of facets to the treatment regimen that we need to do. And one of those is natural joint supplements. And so that's why I sort of created this partnership with OneMD Nutrition, where I can be a physician formulator. But not only that, because I worked with OneMD to develop the actual supplement, I also endorse the supplement. I give it to my patients. I give it to my patients' family members, but I also give it to my family members myself. In addition to that, I even take some of the supplements myself. So I really do have a true deep belief in the power of these natural dietary supplements for overall health in general, but also specifically for joint health.
It's so powerful, and I connect on the same kind of a level. My mom has rheumatoid arthritis, osteoarthritis, and osteopenia. So I'm looking at her, and making sure that I am on a preventative path to not having to deal with that early on in life, for sure. I can just see, like, how that would be such a motivator for you, to help people every day, having had that experience with your mother. It's so cool to meet someone who's so driven and so passionate about something. And that's why I love working with you. I love knowing your family, and just, you're just a great guy.
Thank you.
Yeah. So let's jump into, we polled, over the last couple of weeks, we've been polling our audiences, asking them what kind of questions they have for you, so that we can really dive into arthritis on a more granular level, help people understand the ins and outs of it. So let's start at the very basic level first. So what causes arthritis? We know there are many different kinds of arthritis, but in general, what's that cause?
So I love this question because, truthfully, the word arthritis itself is kind of a misnomer. So the end of the word being itis usually suggests that there's some sort of inflammatory process, that there's inflammation involved. And that's not necessarily always the case with arthritis. So there are multiple different cases of arthritis, like you mentioned. Perhaps the most common is osteoarthritis, and that's more of a degenerative mechanical wear and tear arthritis. So we see people who are in their older years typically getting that. We have joint space narrowing. We see, people look at their x-rays and they notice that the joints are narrowed, that they have bone spurs, stuff like that. And that stuff usually accumulates over time in an aging population. We also see other types of arthritis, overuse types of arthritis, which is usually, repetitive movement, repetitive motion. That can be in someone's profession, that could be in someone's job, that could be with exercise, that could be with high level athletes, and even not. And those patients will typically have a small inflammatory component to what's going on, maybe some tendinitis, tears, and stuff like that. We also see other types of arthritis that are non-inflammatory, like traumatic arthritis. So a patient were to have a fall, maybe with an outstretched arm, injure their rotator cuff, have a fall, land on their knee, injure their meniscus. Those kind of conditions can actually increase one's risk for developing earlier onset osteoarthritis or degenerative arthritis in the future. But perhaps what's I'm most passionate about and what's closest to my heart is those patients with the autoimmune and inflammatory arthritic conditions. So those patients may have the same symptoms, the pain, the swelling, the stiffness in their joints, but the characteristics of those joint symptoms are a little bit different than what you would expect in the non-inflammatory patients. So all in all, I mean, there are different types of arthritis, but the most important thing is to seek care from a doctor, establish early on the type of diagnosis that you have, and so that we can figure out the underlying cause for that arthritis and try and prevent that from getting worse in the future.
Got it. That's a great breakdown. I mean, so it really is like anyone could get arthritis for a multitude of different reasons, basically. We're all susceptible. So we all need to be preventative, right? So what does, you did mention a couple of symptoms just a few seconds ago, but walk us through, what does arthritis feel like? What are the signs?
So the more typical symptoms that somebody would present with for arthritis, and I'm just basically drawing this even from my patients that I saw today in the office. So these patients are coming in primarily for pain symptoms. And that pain can be in any joint. It can be in the joint itself. It can be in the soft tissue or connective tissues that are surrounding the joints as well. So it's mostly pain. That's a driver to get patient into the doctor's office. But other components of arthritis definitely include stiffness in the joints and swelling in the joints. And the amount of pain, the severity of the pain, the frequency of the pain, and the associated swelling and associated stiffness that people experience sort of all contribute to the morbidity that they experience. And that can lead to more sedentary lifestyles because of less flexibility, less mobility, and overall, over time, as this patient develops more pain and maybe potentially because of that sedentary lifestyle, maybe developing weakness because of muscle atrophy, overall, that's going to translate long term into loss of quality of life. And so, the most important thing to do when you start experiencing these signs or symptoms of arthritis, address them with the doctor immediately.
Yeah, definitely. It's sometimes you just think like, oh, well, I knocked my hand up against the wall and my knuckle hurts, it's nothing, but it's always better to go to the doctor and just get it checked out because you never know, right?
Yes, absolutely
And
correct.
now with all of these different, types of arthritis that you've described to us, are there some that are curable, some that are not less curable? Like, walk us through, a prognosis for someone who walks into your office. You say, you have this type of arthritis. Will they be able to resolve that?
So that's one of the biggest challenges that we come across. This is a great question. And this is something that sometimes frustrates us doctors and frustrates the patients. So I would say there are certain types of arthritis that are curable, but not really. Um, Arthritis is this kind of a general term that we talk about, but really, when it comes down to it, is most patients are referring to having joint discomfort and joint pain. And so, when somebody were to have an episode of tendinitis, maybe with a tear or some inflammation of the tendon, typically with certain conservative treatments like physical therapy, maybe some analgesic pain medications or topicals, those patients can get cured. But for the most part, patients with true arthritis, whether we're talking about the osteoarthritis, the mechanical degenerative arthritis, or we're talking about autoimmune types of arthritis, unfortunately, we don't have cures currently. We do, however, have many different types of treatment modalities that can put the patient into what we call low disease activity or even remission from their joint pain. But it is important to note that patients can still have arthritis without having pain. And usually the pain sort of the arthritis has to meet a certain threshold for where that pain begins. And so oftentimes they're coming into the doctor's office late. And that point, unfortunately, many times there's no reversing, there's no cure to that type of arthritis. So overall, unfortunately, most of our arthritic conditions don't have cures, but we do have excellent treatment modalities to get the patient into the place where they can have their pain to be more tolerable, more manageable, and thrive in their lives.
I think this is the reason why we're doing this too, right? Like you said, so many times people come to your office and it's like it's such a far progression. If we could just get this information out to more people, they would be more in tune with their bodies, be able to, put in place some regimens that would allow them to prevent it or to at least, slow the progression down a little bit and get into your office sooner so that, they have these treatments that you can provide for them. So walk us through like what sort of like array of treatments exist for all of the various types of arthritis. Are they invasive or like walk us through what treatment looks like?
So you hit it right on the head. I tend to be a little bit more conservative in my treatments. And so depending on what type of arthritis they have, again, we have to get the patient in the doctor's office. We have to establish a diagnosis and get an early diagnosis so we can create a treatment regimen early on to optimize their best chances of having success long-term with their arthritis. As far as treatments are concerned, I like to keep the least invasive first, and we sort of move up in a progressive way to the more invasive. So usually that'll include things like analgesics, whether it's a topical analgesic like a cream, that may be a patch, that may be an oral medication. The problem is that a lot of the over-the-counter analgesics that we see, in particular NSAIDs or non-steroidal anti-inflammatory drugs, can have side effects at high dose use and prolonged use. So it's important to consult your doctor and use these medications judiciously. Oftentimes, a combination of those things plus a regimen of physical therapy, exercise, and stretching will be enough to address the acute joint symptoms that the patient is having. Unfortunately, a lot of times these arthritic conditions become a more chronic issue, and then we sort of have to move past the more conservative approach. Now, what I will say is that physical therapy is an important component of any treatment regimen, whether it's early on or later on. So But we try the more conservative, less invasive approach first. If those ultimately fail, we oftentimes will progress to injection therapies. This may include cortisone injections. This may include hyaluronic acid injections with certain joints. And if ultimately those fail, sort of the newer techniques involve regenerative medicine. Things like PRP, platelet-rich plasma, or stem cells have been used with a lot of success in the recent years. Unfortunately, there's still a group of patients who will still ultimately fail those more conservative and less invasive approaches. And there are times when surgery ultimately will be necessary. But I always try and exhaust all the more less invasive and more conservative approaches before we head toward surgery.
Yeah, you're speaking to my heart right now because my mom is at that point. She, with the osteoarthritis, it's just bone on bone, and she's exhausted all of her options, and we're looking at knee replacement as, her last option to have a really great active, last quarter of her life. But I think it's great that, even when you're at that point, you still have options, and yeah, it is more invasive, but there's still hope, I would say.
Absolutely.
Yeah. I have some random questions that some of our audience members wanted to ask, and actually one that is kind of personal because I do crack my knuckles. Does cracking your knuckles cause arthritis?
I love this question, and I get this question all the time. I get it from patients, I get it from family members, I get it from random people. So the short answer to that question is no, it's not going to increase your risk for having arthritis. And the process of cracking your knuckles is that there is some sort of like a little bit of vapor or a little bit of gas found within the fluid of the joint. And when somebody cracks their joint, say pulling their finger to crack it, there's the sudden movement or separation of that joint can actually cause that vapor or gas to be removed from the joint. And that's the kind of the popping or cracking sensation that you hear. And the reason why there is that refractory period where you can't crack your finger immediately all over again is because it takes a little bit of time for that vapor or gas to re-enter the fluid within the joint. Now, prolonged cracking of the joints should not cause any increased risk of arthritis, but there are people who note that they do sometimes have a little bit of swelling in their joints after this happens, or sometimes a little bit of weakness with their grip after repetitively cracking their joints. But short answer, no, you should be okay.
Phew. Good. That's fascinating. I had never heard like the actual mechanism of like why you crack, why the sound happens. That's a really cool thing to know. I'm gonna tell my daughter that. Okay, so another random question. Are tomatoes bad for arthritis? I had never even heard of this. Is that a thing?
So yeah, there's a lot of research, and this is actually something that's been talked about, I guess, in myths for a long time, but there is something to it. There is a group of nightshade vegetables that includes tomatoes, potatoes, eggplants, bell peppers, tomatillos, that do have certain components within them that can increase sort of an inflammatory environment within the body, an inflammatory milieu. And that can translate in certain people to developing joint discomfort, joint pain, joint stiffness. Now, it doesn't happen in everybody. And to say that tomatoes are bad for you, I think that's not the right thing to say. There are an incredible amount of nutritious and essential nutrients that we can get from eating tomatoes, including antioxidants. But there are other sources of those same nutrients through supplement form and other vegetables and fruits that one can get if they are noticing that those nightshade vegetables are particularly causing a problem for their joints.
So is there a bigger list then? Like, what are the other foods that we should avoid if you have arthritis or if you have a history of arthritis? Or is
Right. So the Western diet in and of itself is horrible for our joints. I mean, we're talking about high levels of saturated fat, high levels of cholesterol, high levels of protein, and low levels of fiber. That combination is horrible. I mean, it can create a pro-inflammatory environment in the body, and in certain people cause a significant problem for their joint symptoms and joint discomfort. So the Western diet already in and of itself is a problem, which most of us are used to. One of the biggest things that I see anytime that I see a patient for joint discomfort, and I usually mention it on the first time that we see each other, is try to restrict the amount of processed foods and particularly white sugar. We know this for a long, long time. Processed foods are full of bad nutrients, essentially that create um, environments in the body that create inflammation, but also they don't necessarily help with our weight management either. There are a lot of empty calories there, and the same goes for sugar. Other foods, including high levels of alcohol intake, red meat, and we already mentioned nightshade vegetables can be problematic. Now, at the end of the day, every single patient is an individual and needs to be treated individually. So there are other things within people's diets that can cause a problem for one person and not a problem for the other person. So gluten, many people have gluten sensitivities, which can not only cause upset stomach and GI distress, but can also cause joint discomfort. There are blood tests that can be checked, and you can see a gastroenterologist to determine that. But many times patients just discontinue gluten from their diet and they start feeling better. And so that's something that can, in a certain patient population, be a bad thing for their joints. And also sometimes dairy products can be an issue. At the end of the day, anytime that we are avoiding specific nutrients within our diet, it is important to acknowledge the essential elements and nutrients that are within those foods and get supplementation otherwise, especially if they're negating and purposely avoiding large groups of food.
I would say to the majority of the population of the United States, what you just said is pretty scary. It's like, the standard American diet is not good. Alcohol is not good. So tell us, give us like your top 5 foods that people should be eating to just sort of promote the health of their joints.
Right. So I always work to stress an anti-inflammatory diet. An anti-inflammatory diet is very well connected with the Mediterranean diet. So first things first, there's a lot of things to avoid, which we discussed. But the anti-inflammatory diet includes fresh fruits and vegetables, lean protein, so particularly chicken and fish, and particularly fatty fish can be very important. They are chock full of omega-3 fatty acids, which are potent antioxidants. Nuts, berries are also important. All of these things that we mentioned are full of anti-inflammatory properties, are full of antioxidants. These antioxidants can reduce free radicals in the body. And those free radicals, those reactive oxygen species, are the very things that promote inflammation. And it's not only the joints that we're talking about, we're actually talking about systemic inflammation within the body. So our diet is not only focused on helping for joint health, but we're talking about heart health, we're talking about lung health, we're talking about GI health, we're talking about overall body health.
Absolutely. And diet just plays such a key role in that for sure. So what is, aside from diet, and that we've been talking about pretty extensively, what's the single most important piece of advice that you give your patients?
Yeah, so this is the one important thing that unfortunately by the time they get to me, it's almost too late. So it's always easier to try and prevent the onset of your joint problems compared to dealing with the joint problems once they've already developed. And as we mentioned, there's a lot of patients who present to me with arthritis, but they've had arthritis for a number of months, a number of years, sometimes a decade before the symptoms actually develop. So there's a certain threshold and amount of arthritis that these people have before they get the joint pain. And so really the best thing is those patients who are not feeling anything should maintain a good diet, maintain adequate weight management, and be exercising. We can't underestimate the amount that exercise plays an important part here. So maintaining flexibility, maintaining mobility, these are getting off the chair and even exercising a couple times a week, even just walking, is going to help maintain some level of joint care. And again, as we mentioned with diet, this is not just joint health that we're talking about. We're talking about overall body health. So if there's one thing that I tell my patients, unfortunately, oftentimes it's too late, is let's try and prevent joints from becoming symptomatic to begin with. Let's try and prevent the progression of joint symptoms rather than acting reactively.
Yeah, it's a tough job you have. It's like, how do you reach them before they get to your office? Like we need to figure out that piece of the puzzle. I think, a lot of what we do here at MoveMD, with our education series as well, is trying to get this information out, and this critical information out to people to just harp on that prevention, maintenance. How much does aging, though, play into your joint health? Like, can you do all the right things, eat all the right foods all the time, exercise, walk, take your doctor's advice, and then still, wind up with joint issues?
So the short answer is, yeah, sometimes it's going to be inevitable. There are sometimes hereditary components to developing arthritis, but in general, the aging population is that perfect population to have arthritis. So we see with aging, we mostly see the type of arthritis such as osteoarthritis, which again is that mechanical, degenerative wear and tear arthritis that we see. So the wear and tear, the repeated micro traumas on the joints, over time will not only degrade the joints, they'll degrade the cartilage. There are also supporting structures within the joints, tendons, ligaments, other soft tissue structures that can get injured over the course of repetitive micro trauma. It's also important to notice that with the aging process, the quality of those supporting structures in the joint also deteriorate. So, one of the biggest examples of that is I see an older patient come in with shoulder pain and they just had a fall, or they just lifted up something heavy and they can barely lift their shoulder up any longer. Well, that's because over time and the repetitive micro traumas that occurred on their tendons may have injured their rotator cuff to a certain point where it was almost that straw that broke the camel's back. They did this one activity that they've done maybe 1,000, maybe 1,000,000 times in their life, but it was this time that actually caused a large tear. So aging is potentially the largest factor that we see developing those patients developing joint discomfort and arthritis in particular. Unfortunately, the aging population is, we're having a large aging population because of the great therapeutics that we have for many other conditions. Up until now, people were living into their late 70s, and we're seeing people live well into their 80s and 90s nowadays. And so that aging population will have a larger arthritic disease burden moving forward. And it's going to be important to take care of yourself when you're younger to be able to prevent that in the future.
I think that's a great place to end right there. That's some really great advice, Dr. Kreitenberg. I'm so appreciative of being able to work with you every day, and getting this important information out to the world, to the YouTube world. This was really fun.
Thank
you. Absolutely. Yeah, we'll see you soon. Say hello to the wife and kids.
Thank you.
Thanks, Dr. K. Oh man, that was so great. I'm gonna take some of that advice back to my mom and talk to her. It's so tough, yeah, but this was really great. So I'm gonna kick it off now over to Dr. Bradley, who is a star of TLC's My Feet Are Killing Me. He's a board-certified foot surgeon. And I'm so excited that you're here, Dr. Bradley.
Hello, well, thank you for having me.
Yeah, absolutely. So you are in New York, right? You're at your clinic?
Yes, I'm at my office right now. I'm right across from Central Park on 85th Street. So you want to talk about people moving and working out? Everyone's in the park right now. It's a beautiful day.
Nice. You see everyone with their busy schedules just zipping around the city from your office?
Oh, for sure. Yeah, I have a bird's eye view right now. I'm extremely happy to be here. I've been open for about a year. So anyone with arthritis, come on in.
Well, congrats. That's huge. Get your own, your own place, with your own roster of patients and just moving mountains. I know you've done a lot of work in this space, particularly as it pertains to arthritis. But first, I really just wanted to talk to you because you talk a lot about this on your show. My Feet Are Killing Me, about how your foot health reverberates throughout your entire body, and how important it is to maintain the health of your feet. So let's just break it down for the audience and tell them, how they can maintain their foot health and what that means to the health of their body.
Yeah, so thank you. What we do, as podiatrists and really just educating the public on the importance of foot health. And we talk a lot about it on our show. Our feet are our body's natural shock absorbers. So if we think about my little buddy here walking around town, this is going to have a cascading effect on the rest of our body. So all of these little joints in our foot, they're going to have a lot of impact as we start to bear weight, exercise, work out. And the good doctor was just talking about how important that is. So supporting that foot and that beautiful arch that we have is absolutely paramount. Think about it like our feet are our foundation. So once we are stabilized down at our foundation, it's really just going to help the rest of our body. It's going to affect our quality of life, and we're going to be able to live the life that, we all deserve. And going out and playing in a park or, running around after your kids, this is what we belong doing. And unfortunately, arthritis can, really be a bugger in that. So that's why we're here to educate and prevent.
Exactly. I was outside gardening this weekend with my daughter in flip-flops, which was my first problem. And I noticed, I was telling my husband just like 2 hours later, I was like, I swear it's not a pun, but my feet are killing me, literally. It started with my heel, and then by the end of the day, my lower back was killing me. And I knew that it was because I wore the wrong shoes. And it is just really about taking care of that foundation that you said, about your feet and how it holds you up. It's the thing that's, and if you lose that, then it all goes downhill. It's like a slippery slope, right?
Yeah, absolutely. And first off, don't be wearing sandals when you're gardening. That is a no-no. We talk to our patients a lot about when it's cool to wear sandals and not, you try not to walk around the city with them for long distances, really just know where you're going and try to game plan for that. But, if you're going to a beach or something, yeah, you can throw on a flip-flop or a sandal, it's a no-brainer. I do the same thing. But, you could hurt yourself gardening. Anyway, enough of that. So, yeah, like you were saying, like I was saying prior, when your feet are literally your foundation, every step that you take, and with this arch that we have, if you support it with a nice insole in there, that's going to really help your ankle, your knee, your hip, and your lower back. It's a cascading effect. It's like a ripple effect throughout your whole body. So when we're on the show and we're talking to patients about what you can do to start to prevent and help yourself, well, the first step is getting good shoes, then getting good insoles in those shoes. Patients can go to Walgreens or different stores and get an over-the-counter insole. That's really going to help buffer this beautiful foot versus the ground and really just support those bones so they're not moving all over the place and creating, that type of joint friction, which can cause arthritis. If you have a little bit more of a problem, you can come into your local podiatrist and we'll actually fit you for a custom orthotic. And that's really going to offload those problem areas. And those are extremely important. I wear insoles in all my shoes and I rep them very, very hard. When you really think about arthritis, arthritis, and I didn't even know this until this past weekend. I did a walk to cure arthritis in New York City. It was an amazing cause. And they were telling me it's the #1 cause of disability in the US, the #1. So that was pretty mind blowing. 1 in 4 adults are impacted by this. And what's even crazier is 300,000 are children. So what we're doing right now to educate and talk about preventative health is straight paramount to everyone's health. And it really should, have more light shined on it.
Absolutely. I think that my mom she wears insoles on everything too as well. I think I probably maybe should get some.
Absolutely.
I'll come talk to you.
Yes, please.
We had a question. It's and someone's asking live. Oh, see what I told you. My cat's here. I told you it was going to happen. All bets are off now.
Oh,
Come on,
there's the
get
kitty.
down, Garfield. So we're talking a little bit about sort of like those symptoms and how you can identify like, maybe I need to go see my podiatrist. Maybe I have some issues with my foot. Like someone was asking when a joint clicks. So my ankle actually clicks, and so does my big toe on my left foot. Now, what is that sort of? Is that sort of like what Dr. K was talking about earlier, or is that something that may be a little bit more serious that I should go in to see my podiatrist?
It depends. What he was saying earlier, and that's something that I learned about. He described it really well. I mean, I crack my knuckles too, so it's really good to know that we're not necessarily causing ourselves problems in the future. And a lot of patients do come in and complain about that. Now, if it's not clicking due to a bony exostosis or something in your joint, that you can feel that needs to be removed, then it is kind of what the good doctor was just talking about. What we need to do is just get an x-ray to make sure that there's nothing in there. That's how you know that it's nothing serious. But once that's ruled out and you have a clean x-ray, you can kind of rest a little easier, go back to the things that we were just talking about with the supporting insoles, with the proper foot health and shoe gear. That's really going to help us for the long term.
I think it's more commonly thought of when arthritis sits in a joint. You think of hands, you think of knees. How common is it for arthritis to sit in the foot, in the ankle?
Oh my gosh, it's extremely common. It's I would say it's one of the top surgeries that I do, because think about it. Every time we push off one step, or when we're walking or running or jogging, this joint here, it's called your first MPJ, or metatarsal phalangeal joint. When we push off this joint, all of that weight is going onto the ball of the foot and this big toe joint. It's the last joint that goes when we push off. So there's a lot of impact there. When that cartilage inside that beautiful joint starts to wear down, it just becomes bone on bone. When that happens, we do kind of what the doctor was describing. Some doctors will do like cortisone injections and things like that. But nowadays it's regenerative medicine, it's PRP, stem cells, things like that to really stimulate the healing process. Unfortunately, when you do develop end stage, especially arthritis, there's not a ton you can do with that except proceed with a surgical option. So being a podiatrist and doing a lot of surgery, we do a lot of fusions, different things like that, and joint implants. And those are great options to get patients' lives back on track so they're able to go outside, able to enjoy themselves. But we don't want patients to get there. We want to prevent that. So again, that's why I brought my foot model to show everybody. That's why we're talking about prevention. We're talking about the support for your feet. Leonardo da Vinci described it so well. All of these feet, it's a beautiful construct that God gave us. And these need to be supported properly. It's very intricate. So show this guy some love.
I love it. Yeah, it is a beautiful work of art, that's for sure. Our feet, it is extremely intricate, and we have to take care of it. So what's next for you on TLC? What do you have? Anything coming up that you wanna tell the world about? We're global. Any news?
Well, the show is absolutely shining light on, with people's feet. You don't have to have that shame. You don't have to live with pain, because we're bringing pretty extreme cases, to the forefront. And, with Dr. Pimple Popper and what she's been doing for skin and health, we're really bringing that to feet, because a lot of people just throw a sock on, throw a shoe on, cover that shame up. Well, there is a lot of embarrassment, unfortunately, that comes with the feet. I think feet are awesome. Some people find them sexy, and some people find them gross. So the foot has, a really fun and also disgusting, side to it. So what we're doing is we're just educating people that it's normal, that people are dealing with this. And there are so many people that walk in to my door, to my office, and they're just like, Dr. Schaeffer, with this show, I finally realized that, this person, down the street, or, this person in the next state has the exact same problem as I have, and I'm not embarrassed anymore. So that's why I think this show is absolutely amazing, to just show people that they're not alone, and that there are treatment options out there. And at the end of the show, we show the outcome. So we see the patients' lives getting back to normal. We'll show them running, or playing with their kids, different things like that. So yeah, every episode, there's just something even more wild, because we're on our 4th season. So we're really searching and looking for people that their stories need to be told. And, we're on Wednesday nights at 9. So there's a lot more stories that need to be told. And, talking about arthritis and prevention is something that we talk about a lot. It's something that I talk about every day in my office. So, yeah, check that out.
We will, absolutely. It's such an aspirational TV show, and I just want to thank you again so much for being here. And we look forward to seeing and hearing a lot from you in the near future. Thank you so much, Dr. Bradley.
Well, thank you. It's my pleasure. Thank you.
Absolutely. Take care. Oh, that was so cool. I don't know if you guys watched the show, TLC's My Feet Are Killing Me, but I've watched like almost every episode. And, sometimes it gets a little bit like, oh my God, what am I about to watch right now? But at the end of every show, it's always just so, like I said, aspirational. And I think it's shining a light on, a part of the body that, like Dr. Bradley said, is neglected a lot. So yeah, I'm so glad we could have him on. We are going to announce our winner. We're giving away a 3-month supply of 1MD Nutrition's MoveMD. And the winner is Brian Hillman. So congratulations, Brian. You can give us an email, send us an email at partners@onemd.org. That's PARTNERS@onemd.org. And that's pretty much it for us. We're wrapping it up. Just thank everyone for tuning in today. If you like what you saw here, please subscribe to the 1MD Health channel. We're going to be doing a lot more programming here on our YouTube, as well as on our Facebook. And yeah, just getting a lot more education out there for you guys to stay healthy and happy. And we will see you later. Bye, everyone.